Did you know that skipping only one small area during your everyday wash might be damaging your health? Many individuals shower, brush their teeth, and believe they are clean. But according to Dr. Mary Williams, a geriatric expert with 30 years of experience, a lot of people, particularly elderly people, are ignoring 4 essential body parts, and what happens as a result? Poor hygiene, infections, and possibly long-term health issues. The most shocking part? About 86% of the American population is cleaning one of these places the wrong way, or even worse, not cleaning it completely. This is why in today's video, I'm revealing 4 body parts you have to wash every day to stay healthy, feel fresher, and potentially add years to your life. And trust me, you will not believe the last one. So stick around until the end. And if staying healthy and independent is important to you, hit that like button and let's get started. Body part number 1. The tongue, your mouth's hidden germ collector. Why it's a problem. Your tongue is much more than a surface. It has small grooves and ridges that keep bacteria, dead cells, and leftover food particles. Gradually, this buildup develops a white or yellowish coating, which not only causes unpleasant breath but also becomes a breeding space for dangerous microorganisms. Studies indicate that up to 80% of unpleasant breath cases come from the tongue, not the teeth or gums. And the effects transcend just oral hygiene. Bacteria from the tongue might reach the bloodstream through little cuts or gum inflammation, increasing your risk of heart disease or stroke. A coated tongue decreases taste sensitivity, which makes food less tasty and occasionally even contributes to poor appetite in elderly people. A buildup of dangerous microbes can damage the immune system, leaving the body more susceptible to infections. Fungal infections, including oral thrush, develop on a dirty tongue, particularly in elderly people who have weaker immune systems. Dr. Mary Williams warns, a dirty tongue does not just affect your mouth, it affects your whole body. Most individuals brush their teeth for many years, but rarely clean their tongue effectively, and it's a mistake that might be costing them their health. Fix. Cleaning your tongue effectively takes only a few minutes per day, but may have a significant impact on your general health. Here's the best way to do it. Use a tongue scraper or soft toothbrush. A tongue scraper is a highly powerful tool for getting rid of buildup. If you don't have one, a soft bristled toothbrush is an alternative. Scrape or brush delicately. Begin at the back of your tongue and proceed forward using moderate pressure. Repeat 3 or 4 times to clear out as much debris as possible. Don't press too firmly since this might irritate the surface. Rinse well. After scraping, rinse your mouth using warm water or an alcohol-free mouthwash to wipe away bacteria. Practice it twice every day. The best times for brushing your tongue are first thing in the morning to get rid of overnight buildup and before bed to stop bacteria from developing while you sleep. Adjust if you gag. If you have a strong gag reaction, begin cleaning from the middle of your tongue and slowly work your way further back as you get used to the experience. Replace your scraper or brush frequently. Like toothbrushes, tongue scrapers pick up bacteria and must be replaced every 2 to 3 months. Many individuals notice fresh breath, better taste, and possibly better digestion after only a week of frequent tongue cleaning. It's one of the easiest habits that can safeguard your health for many years to come. Real-life example. Elizabeth, 68 years old, has been battling bad breath and frequent cavities for a long time. Despite switching toothpaste and using mouthwash, nothing seemed to be working. Her dentist eventually asked, "Are you cleaning your tongue?" She began using a tongue scraper each morning and night, and after only 2 weeks she noticed fresh breath. No more unpleasant taste in her mouth upon waking up. Fewer cavities and healthier gums at her next dental appointment. Improved digestion since removing bacteria from the tongue improved her gut health. Many individuals disregard their tongue, yet it's a simple remedy that makes a significant impact. Try it for a week. You'll feel the difference within minutes. Have you ever cleaned your tongue every day? Leave a comment if this is something new for you. Body part number 2. Feet, the basis of your mobility. Why it's a problem. Your feet carry you through life, but they are usually the most overlooked part of your body. A simple rinse in the bathroom is not enough. Dirt, sweat, and bacteria collect between your toes and on the soles of your feet, resulting in fungal infections. Warm, damp places like inside shoes cause fungus to develop, resulting in athlete's foot, toenail fungus, and unpleasant smells. Cracked heels and dry skin. Gradually, lack of moisture and poor care might cause painful cracks that could become infected. Inadequate circulation. Feet are one of the first body parts that show signs of lowered blood circulation that can contribute to cold feet and slow recovery of injuries or wounds, particularly detrimental for diabetics. Hidden health warnings. Your feet can reveal signs of serious health issues, including diabetes, nerve damage, or circulatory issues. Overlooking changes in skin color or swelling can delay important medical attention. Many elderly people don't know that healthy feet are crucial to balance, flexibility, and preventing falls. If your feet are hurt, you're less inclined to stay active, and that might speed up general health issues. Fix. Taking only a few minutes each day to care for your feet may prevent infections, improve circulation, and keep you moving easily for many years to come. Here's what to do. 1. Wash properly each day. Use warm water with some soap. Pay extra attention to between your toes, where moisture and bacteria can hide. Consider it like washing window curtains. You have to get into every crease. 2. Dry completely. Moisture accumulated between toes creates an ideal environment for fungus. After washing, wipe your feet dry with a clean towel, being sure to reach between every toe. 3. Moisturize, but not between toes. Use a small amount of moisturizer on your heels and soles to prevent dryness and cracking, but do not apply lotion between your toes. It may retain moisture and result in bacterial or fungal infections. 4. Cut nails properly. Cut straight across to avoid painful ingrown toenails. If you struggle with thick nails, soak them first to soften them before cutting. 5. Massage and improve. Massaging your feet for only a few minutes per day increases circulation, decreases swelling, and soothes soreness. Elevating your feet when sitting also promotes blood circulation. 6. Check for changes. Check your feet every day for any new sores, swelling, color change, or cuts that are not recovering. These might be symptoms of circulation issues or diabetes. If you notice anything strange, visit a healthcare provider. Real-life example. Jacob, 74, never paid attention to his feet till he got a fungal infection in between his toes. After commencing an everyday foot care routine, not only did the infection clear up, but his balance got better and he felt stronger when walking. I never realized the way better I'd feel just by taking good care of my feet, he said. Taking good care of your feet isn't merely about comfort, it's about staying active and self-sufficient as you age. Body part number 3, armpits, the hidden detox zone. Why it's an issue? Your armpits contribute more than just sweat. They perform an important role in your body's natural cleansing system. Underarm skin has lymph nodes that help filter toxins and prevent infections. But when bacteria and product accumulation aren't thoroughly wiped away, they can clog pores and contribute to discomfort, rashes, or painful lumps. Overload your lymphatic system, making it difficult for your body to flush out toxins. Increase body odor when bacteria break down sweat and generate strong-smelling substances. Lymphatic congestion. The lymph nodes in your armpits assist in filtering toxins from your body. If this region isn't washed thoroughly, toxins could potentially build up, damaging your immune system. Skin irritation and rashes. Sweat and leftover deodorant can clog pores, resulting in irritation, redness, and uncomfortable lumps under the skin. Higher probability of infections. Moist, filthy underarms give the perfect setting for fungal or bacterial infections, especially for seniors with sensitive skin. Hindered detox process. Your armpits have an important role in removing waste through sweat. If they're clogged with compounds from deodorants or buildup, this natural detox role is compromised. Most individuals believe deodorant is enough, but it just conceals odor. It doesn't eradicate the bacteria that are causing it. Proper underarm cleanliness is vital for immune function, good skin health, and general health. Fix. A simple everyday routine can keep your armpits clean, fresh, and operating effectively. Wash every day using gentle circular movements. Use warm water and a mild soap to wash properly. Move the washcloth upward and downward, side to side, and in circles to cover all regions. Rinse thoroughly. Leftover soap might trigger irritation or clogged pores, which results in underarm breakouts. Allow skin to breathe before using deodorant. After being dried, wait some minutes before putting on deodorant. This helps your skin's natural oils to regulate, decreasing discomfort. Detox with an occasional armpit mask. Once every week, use a combination of baking soda, water, and apple cider vinegar to gently scrub away and eliminate built-up toxins. Use a suitable deodorant. If you encounter regular irritation, consider using an aluminum-free deodorant or a natural option like coconut oil. Apply natural deodorants. Many traditional deodorants contain aluminum and toxic substances that block pores. Rather, consider aluminum-free alternatives or ones with coconut oil or witch hazel for odor management. Avoid shaving irritation. When you shave, use a clean razor and a nourishing, non-irritating shaving solution to avoid razor burns and ingrown hairs. Check for lumps or changes in the skin. Swollen lymph nodes, chronic irritation, or lumps should always be checked by a healthcare provider. Real-life example. Laura, 67, battled with recurring rashes and discomfort under her arms for many years. She thought it was just delicate skin, but after changing to a natural deodorant and a good cleaning routine, her feeling of discomfort entirely disappeared within weeks. I never thought my deodorant was making situations worse. After switching to a soft, natural technique and actually cleaning my armpits properly, my skin feels better, and I don't have those itchy red patches anymore, she said. Now, Laura also performs a weekly armpit cleaning with a simple clay mask, and she's noticed reduced body odor even before using deodorant. Body part number 4. The nose, your body's air filter. Why it's an issue. Your nose is not just for smelling. It's your first line of protection against airborne diseases, viruses, and allergies. Each day, it filters out dust, harmful substances, and dangerous microbes, preventing them from harming your lungs. But when it's not thoroughly washed, these particles collect and create problems that make it difficult to breathe. Increased allergy flare-ups, resulting in regular sneezing and watery eyes. Higher risk of infections as trapped bacteria and viruses grow in warm nasal passages. Snoring and poor sleep quality due to limited airflow. For elderly people, a clogged nose is not only bothersome, it can affect overall health. Poor nasal cleanliness can compromise your immune system, leaving you more vulnerable to colds, flu, and sinus infections. Gradually, breathing issues can restrict oxygen intake, resulting in exhaustion, brain fog, and even dizziness. Regardless of these risks, most individuals don't wash their noses properly. But with just a few easy steps, you can breathe less difficulty, sleep comfortably, and safeguard your respiratory health. Fix. Use a saline rinse every day to wash away dust, bacteria, and allergens. A simple saltwater remedy keeps your nasal passages moist and clean, decreasing irritation and congestion. Breathe in steam from a shower or bowl of hot water to release mucus and clear congested airways naturally. Avoid medicated nasal sprays unless recommended by a healthcare provider. Excessive use of decongestants can worsen nasal dryness and cause dependency. Lightly blow your nose, one nostril at a moment, to prevent excessive pressure accumulation, which can lead to sinus infections. Use a humidifier in dry conditions to keep nasal tissues hydrated, minimizing discomfort and inflammation. Practice suitable hand hygiene before touching your face or nose to prevent bacteria from getting into your nasal passages. Try nasal massage by softly pushing on the sides of your nose while moving in circular motions. This promotes circulation and helps relieve congestion. Drink lots of water to keep your mucous membranes hydrated and operating well. Limit exposure to dust and allergies by frequently changing pillows and cleaning your living environment. A clean nose helps you breathe more comfortably, fall asleep more peacefully, and fight off diseases more effectively, all with only a few minutes of care every day. Real-life example. John, 67, has been suffering from allergies and persistent nasal congestion for more than a decade. Each morning he woke up feeling stuffed up, finding it difficult to breathe well throughout the day. His doctor recommended allergy medication, but it only gave brief relief. A few days later, his friend advised him to try a simple saline rinse each morning and evening. Initially, John was doubtful, but after just a few days of using a saline spray, he began to notice a change. His breathing felt better, and he was not waking up with a dry, irritated throat anymore. After 3 weeks, John experienced even more benefits. His sense of smell improved, He slept more comfortably, and he no longer needed his allergy medication as regularly. I did not know how much congestion was affecting my daily life, John said. Now I feel refreshed each morning, and I don't go through the day feeling sluggish and stuffy. By adding just one basic habit to his routine, John revolutionized how he breathed, relaxed, and felt, indicating that nasal hygiene is more essential than most people think. Now I want to hear from you. Which of these shocked you the most? Drop a comment below.